Boy, sadly in California and in the US in general, that can change in a moment. So what we do as an agency is we work with a couple of insurance brokers who know which plans are surrogate friendly. And that is, Rich just sighed a little bit. I'm not sure why, but
I'm dying to jump in.
So, some surrogates already have insurance in place, but that's becoming more and more rare that they have insurance that will cover surrogacy. If it does, they will generally have a lien right to a certain amount of money. They base it off of the surrogate's compensation, generally speaking. And so that is often, it has to be signed before the hospital will even take the surrogate as a patient. We try to get this insurance in place. The cost is, if you can get a surrogate-friendly insurance plan, then you're looking at approximately $15,000. Wouldn't you agree, Rich? 15 is kind of a minimum. That includes the monthly payments for the and the copays, and the deductible generally runs about $7,500. That is on the low end, and if we can find the perfect policy, that's what we try to get. But we have had some insurance midstream, mid-pregnancy, change their minds, and that's where working with a good insurance broker is very helpful, because they were able to help us get into a new plan. There are some more expensive plans. Bridge the Gap is one. The Lloyd's of London is another one. And because in the US we have enrollment times, we have to have insurance in place before most places. It's January, the end of January is kind of the maximum. But there are a few states where pregnancy itself is a trigger to be able to get insurance. So that's really, something that we're looking closely at, which states have that provision made. But the insurance is the most expensive. I would say you're looking 15 for a singleton, Rich, maybe 25 through Lloyd's of London.
Oh yeah. Oh, for singleton? Yeah. Now the premium for a Lloyd's policy would be in the range of 12 to 15,000, and then you self-fund the deductible for twins or for singletons at 20 or 25,000, and then Lloyd's will pay the medical bills with the money that you've given them. And then once you've reached that maximum, they'll cover everything else after that up to a preset limit, usually more than enough to cover the maternity expenses.